This is Melissa Juracic presenting on virtual reality treatment for spider phobia. It's an analysis of Anderson et al.'s 2024 study. So this study was a pilot study aimed at assessing treatment effects and acceptability of a one-session virtual reality treatment for spider phobia designed by the authors. Commonly, phobia is treated by graded in vivo exposure therapy, which aims to reduce avoidance, catastrophic thoughts, and negative affects surrounding the phobia by exposing the patient to increasingly intense contact with the stimulus. So virtual reality exposure therapy, or VRET, is the use of virtual reality hardware to simulate in vivo therapy, containing visual at minimum, but most often also audio and tactile simulations of the phobic stimulus. This particular article, unfortunately, had a very skeletal literature review. They do mention that VR therapy, is effective. It's as effective as in vivo therapy, and that attrition rates are lower. They do mention that patients still, though, unfortunately, avoid treatment due to fear, and that treatment outcomes for virtual reality therapy can vary. Although, again, it's not clear what they mean by treatment outcomes. I'm not sure if that's completion rates or symptom reduction. But otherwise, these are just merely declared and cited. They're not really unpacked. So there's not really a literature review, say, comparing in vivo versus VR, VR versus waitlist. There's not really any deconstruction of other VR treatments and where they've fallen short. There's no sort of references to the model that they use, which is Earth's one-session treatment model. So there's no references demonstrating that model's effectiveness, lower attrition rates or higher satisfaction rates compared with other models, or its use previously in vivo or virtual reality environments. And lastly, there's not really any description of the virtual reality program or any aspects of it that would indicate it's different or superior to any other programs that have come or to in vivo treatment. So yeah, again, the authors designed their own virtual reality program, and it is based upon Earth's one-session treatment model. They do mention this, but not in the literature review. So Earth's one-session treatment model is one intensive session of graded exposure therapy combined with ongoing in vivo maintenance post-therapy. This was a great choice in model because this model overwhelmingly demonstrates effective ongoing symptom reduction. It's used in research and in practice. So that was a good choice. Otherwise, the authors don't appear to be replicating any previous studies or theoretical models. Again, without a clear theoretical base or, sort of research, a literature review, it's not really clear where these hypotheses actually came from. Pardon me. Nonetheless, the authors hypothesized that their program would result in reduction of fear symptoms, that most participants would accept the treatment when offered, that most would complete the treatment, pardon me, and participants would report high levels of treatment satisfaction. So these were all measured by psychometrics, the spider phobia questionnaire, the fear questionnaire, and the behavioral avoidance test and qualitative interviews. I do think the mixed methods methodology here was suitable given the low sample size of 12 and also the fact that it was a pilot study. So it's fair to start from the bottom up when you're doing a pilot study for the first time. So 12 participants all up, all female aged 18 and 54. Criteria for inclusion, they had to have a self-reported fear of spiders. They had to be able to physically complete the VR treatment and have no comorbidities. I do think participants with substance dependence should have been excluded. This is exclusion criteria and a few other studies, presumably because substances can alter consciousness, or even just distort, some of your cognitions or even motor, your movements. They can overall, it can impact perception and probably the virtual reality experience. So that's probably something that should have been controlled for. Milov et al. Also excluded any participants that had had previous experience with virtual reality therapy. Probably again should have been exclusion criteria in this study, given that this study aimed to determine acceptability of of virtual reality therapy. So it probably would have been best to only include people that had never been exposed to it before, just to start from zero, really. So the game itself consisted of 6 levels of exposure, from handling a container with the spider inside it to picking up the spider itself or within the virtual world. And participants were instructed to continue in vivo maintenance post-treatment, which is following Earth's model. They found mixed support for their hypotheses. There was small but statistically significant reduction in symptoms for some participants. So the authors calculated a reliable change index given the small samples. So meaning that participants had to fall between, pardon me, the rate of change had to fall between 0 and 1.96 for the metrics. So this is on top of the p-value. So both the RCI and the p-value had to be significant. I think this probably did minimize some type 1 errors, as the authors report that some participants were significant RCIs and some were not, according to the RCI. Where I think the analysis was lacking was there was no retest of the behavioral avoidance test at 1 week follow-up, possibly for efficiency so that they could complete a phone interview only. However, other studies utilize the BAT as a variable, and it is a very effective, pardon me, yeah, it's a very effective assessment of how effective the therapy was, of whether you are able to approach the stimulus or not. So it probably should have been included just to give a more richer data, richer evidence base. Regarding acceptance, 6 of 18 registrants did not participate, so did not continue. And then 1 participant dropped out prior to full completion. So I would argue hypothesis 2 is inconclusive. I'm not sure if 66% qualifies as most participants, certainly not the overwhelming majority that accepted the treatment. Hypothesis 3, though, that most people would complete it, I think was supported. There's actually no reference to hypothesis 4, treatment satisfaction. Presumably the interview was meant to analyze that. What did come out in the interview was fear and loathing, so affective and cognitive reactions, task progression, so the gameplay and presence, so the realism and the ability to self-immerse. And there was positive and negative feedback across all 3 of those themes in the qualitative data. I think probably what could have been included as well is something akin to the satisfaction with therapy scale, just as as an partner to the interview data, just giving less ambiguous results regarding treatment satisfaction. In discussion, the authors do cite that some of their hypotheses were supported. However, they acknowledge that the varied RCI, the small sample, the non-randomized study design, and even the fact that participants were exposed to the BAT prior to treatment could all have distorted their results. Not identified, though, I think, is the potential impact of post-treatment in vivo maintenance. So this has actually been demonstrated previously to be a moderated of self-reported fear reduction post-VR treatment. So it's probably a confounding variable that was missed there. However, that's a base for future research. The authors do discuss the qualitative data as potential contributors to attrition in general in VR therapy. However, they don't reference their own study. So there's no reference to the 6 participants that retreated after registration and why they may have retreated or why that would have been the case. And again, hypothesis 4, treatment satisfaction, is not really referenced directly in the results or discussion section. So I can't comment on that, unfortunately. So overall, I think the study, basing the study on Earth's OST model, was a good choice. It's an effective framework for phobia treatment. I think adopting a mixed methods approach was appropriate for a pilot study, and the authors do realistically and transparently interpret their positive results. However, I think the study suffered from really unclear aim and goals and variables, and not very well justified hypotheses. I do think the BAT and the subjective units of distress weren't utilized, and there was room for some more psychometrics. Some confounders weren't controlled for, substance abuse, V-rate use at home maintenance, and hypotheses 2 and 3 were not actually directly discussed, unfortunately, so they missed that. And here are my references.